Good morning, YouTube. Happy, what are we at? Wednesday, Tuesday? Happy Tuesday. It is March 8th, 2022. Um, and I wanted to come on live and talk a little bit about ADHD post bariatric surgery. I am 10 plus years, almost 11 years post op bariatric surgery. And I have recently been diagnosed with ADHD. And if you know me or you've watched my videos, that's probably not terribly surprising because I can be all over the place. I have taken my medication this morning and had a cup of coffee, so hopefully I'm good to go. But why would these topics? Why would they even go together? Why would ADHD and bariatric surgery go together? And I want to talk about what I've learned, what some of the downfalls post surgery, and honestly, this could probably be a series. I thought jumping on, doing a live, and just kind of putting all my thoughts out there, and then I may probably make some better videos breaking it down. So I always like to do a quick update of where I am weight wise. I'm still about 194. Didn't really weigh myself this morning, but I try to only weigh myself once a week now just because that can be addicting. There's a video, right? And I 194. Haven't really lost, I don't think, anything recently, but that's kind of the interesting thing that I want to talk about, and my new medication and what I've started and how that's affecting post-op. And it's been a conversation I've had with a lot of people about, well, I've had surgery, but then I'm not really eating that much because my medication and what that looks like. So on a lot of comments I've read recently, just on old videos, people talk a lot about medications post or pre-surgery, post-surgery for pain management, for other health issues and dealing with constipation and things like that. Um, and and then also like the way our body now metabolizes medication, because we don't have a large stomach and you can't eat a lot of food before you take your medications. Sometimes intake on liquids is really hard. So I definitely think this is a valid thing to discuss. And I'd love to get your comments and talk to me a little bit about what you're struggling with, because truly I would like to have a forum. I'd like to have a community where we can support each other long term, and it's not just that first year. Um, so pre-surgery, I wasn't really on any medications. I was in my 30s. And then about 40, I've had a hysterectomy. I could talk about that in another video a couple years back. I think I did it around the time my 5-year update. There's another video about that. Um, but I was really dealing with anxiety, or what I thought was anxiety. And I got some medication for anxiety, and I felt like it helped, in the sense of like, it helped. The way I described my anxiety medication is, if I had like a gushing wound on my arm, I felt like the anxiety medication was like a loose bandage over that gushing wound, but we weren't actually addressing the wound. So, like, the blood was kind of stopping, but it was still bleeding underneath that Band-Aid. So you couldn't really see it as much. Yeah, that's a good analogy. You couldn't really see the wound, but the wound was still there and the wound wasn't being treated. And so I eventually went off of the anxiety medication, and I was eating a lot and I was drinking a lot. I was drinking a lot of alcohol, as a lot of people were the last 2 years with COVID and all that stress and anxiety. And I just kind of assumed that and I think that was feeding into my anxiety. But something else that happened in the last 2 years is, I had a little bit more time on my hands, and I was at home more because of the COVID restrictions, especially here in California. And we're in the event industry, so a lot of the events weren't happening. And what I'm learned is that I always picked career paths that demanded a lot of me. So whether I was in medical speech pathology and I saw a lot of patients and there was just like a lot of chaos around, I thrived a lot in a chaotic environment. Um, and pre-op, I was eating a lot to get that dopamine fix, to reward myself, and then realize that's why I had a weight problem. Is I was eating my feelings, I was eating my stress, or what I thought was stress. But a comment that my husband always said was, Chris, you can just never be still. You can just never relax. You always have to have something on your plate, always. And I was like, I guess I do always have to have something on my plate, but then what else would I do? And it wasn't in the sense of like healthy, like you have something on your plate in a healthy manner. It was like you're creating chaos and not necessarily drama, but like I would stack too much on my plate to do so that I had an excuse to not get it all done. I'm like, oh, I'm just obviously too busy because I needed to jump from task to task to task to task, not realizing that was ADHD. And ADHD is very underdiagnosed in women, as I'm learning more and more and more about it. So both my kids, our kids, were diagnosed with ADHD. One is inattentive, and one is hyperactive. Um, and they're severe, and they started medication. They're on Strattera, and it worked really, really well for them. And I saw myself a lot in my younger son, and I started like I'd get frustrated at him of like, dude, we told you to put your shoes on. And oh, sorry, mom, forgot. And then I would notice myself doing a lot of those things of like leaving for our studio and not having shoes on my feet. Like who does that at 40 years old? It's because I got distracted and there was 5 other things that I did. And I know we all can get distracted. And I know that like I understand that that's a commonality, that that's not necessarily ADHD, but there's so many other things. One of the big things that I learned about is people, specifically women, who have undiagnosed ADHD tend to binge eat. And if you watch some of my earlier videos, I am so embarrassed about it because I probably shouldn't have talked about it, but I was really, really real with you guys. I talked about chewing and spitting out. And that's now I'm realizing that's because I was dealing with what I thought was anxiety. What I'm now realizing was a hyperactive mind that would then lead to anxiety. So I did have anxiety, but it was because I had all these fleeting thoughts going through my mind. And then I was stacking my list too full so that I was never getting everything done. And then I was kind of constantly failing. And then I was looking for a dopamine high because I have an underactive frontal cortex, which is the whole ADHD thing. So that I would go get a big thing of donuts and a 32-ounce thing of iced tea. And I drink the iced tea. This is post bariatric surgery, by the way. I drink the entire iced tea first because that can go through your sleeve. And then I would chew and spit out a whole thing of donuts. And I would just sit in a parking lot and do that. Not a good idea. By the way, that is a form of bulimia, which I learned later, which again, super embarrassed. I hope not a lot of people followed me on that. But again, I'm learning through this process, which now I'm realizing was the bulimia. And like, I used to sit there and go, why am I doing this? Why am I doing this? It was because I was anxious, and I was anxious because I had an overactive mind, which was ADHD. So again, the anti-anxiety medication was that like loose bandage over a gushing stream. Um, Fun fact, TikTok kind of helped me recognize, and again, there's a lot of commonalities of people who don't have classic ADHD. I understand people who have binging problems doesn't necessarily mean they have ADHD. I'm just saying it was like one of 20 components that all of a sudden it really, really made sense. In order to have and be diagnosed clinically for ADHD, you have had to have shown symptoms and been at a diagnostic state before the age of 12. And so if you're in your 40s and you're getting diagnosed, you have to have like some kind of a proof that you had those symptoms before the age of 12, which my parents, when I talked with them, they're like, oh no, we have always known that you had ADHD. And I'm like, we don't treat that. Well, 20 plus, 30 plus years ago, the only thing was Ritalin. And I was doing really, really well in school, and I was an overachiever. And so why does she need medication? She's doing great. Well, I was doing great, but I was like spinning and spinning and spinning and chewing. And I had bulimia in high school, and I had anorexia in high school, and poor eating stuff in high school. And I overthought stuff, and dealt with depression and anxiety in high school and in elementary school. And so so then, I had surgery 10 years ago, lost a shit ton of weight, got really, really skinny, was chewing and spitting out, got down below like 160, 150 something pounds. And at 5'8" with like probably about 15 pounds of skin on me that needs to be removed, that made me like 130s, 140s realistically. Saw a surgeon to get my skin removed. He said he wouldn't touch me because I had body dysmorphia and because there was no fat on my body. And I'm like, yes, there is. There's this. And he's like, no, that's skin and tissue. And he's like, I can't touch you because you're not good here, which was like probably the most ethical thing anybody could have ever done. Super sad. And then I was like, well, then fine, I'm going to get fat again. And so started putting weight on again. And then, you kind of go, well, how are you putting weight on? I wasn't chewing and spitting out. I was just chewing and swallowing and then eating on and off all day. Fast forward a couple years, we got COVID in the house, and now I'm drinking a bottle of wine a day, or I'm drinking too much other alcohol, or I'm eating things that can slip through my sleeve, and I'm just eating on all day. Um, I did keto a couple years ago, and I can do a video on that. That was actually fantastic for me. But, and I say but because the caveat is the ADHD, because I've learned that there was like things that I tried through this whole process through the last 10, 11 years post-op, but also pre-op, um, where you could see the fat on my body. And that was a direct response to binging and eating too much, but just not getting it out of my body, like throwing up, which is obviously an eating disorder, obviously, to now being diagnosed and being on medication. I have learned, oh, now that we've stopped this gushing blood, which was the ADHD, I can, not that I still don't have some issues with it, but we can now address what the real problem was. And that was ADHD. That was a hyperactive mind. The medication I'm on is Adderall. I'm sure you've heard it. It's a black label drug. It is something that is very hard to get unless you've been prescribed for it. And it's very often abused. So I was very anxious about starting it. I am not doing XL. I'm doing fast acting. So it's in and out of my body within 6 hours, and I kind of take it as needed. But for me, it slowed my thinking down. It slowed my brain down, and it allowed a dopamine response so that I don't feel like I need to eat something to get a dopamine response, and I'm able to be a lot more productive. That being said, it also suppresses my appetite. And since I can only eat 2 to 3 ounces in a sitting, even 10 years post-op, I'm not eating very much. And I have gone a day or two without eating, which is part of the reason I'm having my recent weight loss. So there's some checks and balances. And I'd like to actually start talking about what you can do to make sure that you eat enough, some strategies that I've done that are helping specifically for somebody with ADHD who can, even on medication, I'm like, squirrel, right? So I want to put that out there as a live and just kind of tell you that for me, that was like an answer to so many things, like my weight issues in the past, my eating disorders post-surgery with the binging and purging or the chewing and spitting out, with the anxiety, all of that. Now, is that a fix-all? Absolutely not. But I am working through that. And I'm excited to come and make some videos on as I learn what I'm learning and hopefully giving back to the community and helping you guys out. I am going back and starting to answer old comments. So I apologize. I just let this YouTube channel just dwindle. And I'm realizing that there's very little help for those of us that are 5 years post-op. So let's work together. Let's help each other. And if I can answer any questions, I'd love to do that. But I'll make a proper video about the ADHD and diagnosis and medication as well. Thanks for listening. Drop some comments in there. I'd love to hear how you're doing, or if this was helpful at all, or if I was all over the place, how I can serve you a little bit better. So thanks.